FMT is a new treatment modality that is being explored for autism. FMT is essentially called as fecal microbiota transplant. In layman terms, it is taking out the poop from the healthy individual and transferring that poop to the affected individual's colon. So this is called fecal microbiota transplant. It can be done through oral or colonoscopy or any mass in multiple modes of delivery. Children with autism, they inherit a phylogenetically different ecosystem. They have a susceptible microbiome, and because of this susceptible microbiome, they face lots of medical issues. Hence, fecal microbiota transplant is explored for autism, and FMT is also being explored for many medical conditions too. Gut and brain are connected, so this is also called as gut-brain axis. People say that gut and brain are connected through vagus nerve, and some other thought process is also there. Enteric nervous system and central nervous system are directly connected, and that is also called as second brain. And other thought process is also there. Gut microbiome metabolites they get into the circulation, and they go to every organ of the body and interfere with the epigenetic pathways in every organ and play a major role in physiology of every organ in the body, including brain. Yes, FMT is scientifically proven for autism in real world experience and some clinical trials also there. One study came from Arizona State University in 2019, which has shown its efficacy, and but it is not yet approved, and it has to undergo many clinical trials and has to be proven. Data has to be proven right now. But with real world experience, many researchers and clinicians are seeing benefit of FMT in autism children. Gut microbes are connected with the sleep physiology and overall mood, neurotransmitter balance, and they have a role in the immune system regulation and digestion and absorption. Children with autism have this. Most of the children have this digestion issues, immune system issues, and the neurochemical balance. Because of that, they have sleep disturbances and they have mood disturbances. These are all things can be settled, and sensory issues and fine motors get settled with this neurotransmitter balance, and their cognitive abilities, learning capabilities, understanding abilities improve after fecal transplant. And coming to the immune system, their overall immune regulation is better, and their allergies and intolerances get better, and their ability to fight against opportunistic infections like yeast infections, candida infections, or other infections improves, and their overall digestion and absorption improves. They will require less supplementation after FMT. Safety of FMT is established in adults, and in the Arizona State University study also, first phase is over. And they are exploring the second phase study, and some of the other studies also there. But it seems to be safe. We have some real world experience. From that, we can say that it is safe, but the safety has to be established in the clinical trials. So FMT works best in the first 7 years of life, where the neuroplasticity is active, because in autism we are trying to modulate the brain function. So the first 7 years is the best time that we observed, but FMT works at any age. So with the age, increase in the age, the benefits gets limited. So we prefer doing it in the early age. So FMT can be administered through oral capsules, enemas, retention enemas, colonoscopy. But we prefer retention enemas because oral capsules get digested. The microbes, 99% of the microbes in the capsules get destroyed in the stomach acid, and rest of the microbes, they undergo enzymatic digestion in the small intestine, and very few microbes reach to the target organ. So we prefer rectal enemas or colonic retention enemas. We prefer, and it has to be done on a regular basis, like for a longer period, to get the desired result. So their existing microbiome has done immune priming for them, and so the new microbiome that is being introduced will not be able to survive there. The existing environment is not suitable for the new microbiome to colonize there. Hence, they require a long course and a high dose, and with a proper bowel cleanse on a daily basis. At least what we have seen in our research is like children need 2 to 3 months of treatment on a daily basis through any mass direct with a proper bowel cleanse is needed for the long-term success. We need a proper bowel preparation. So we need to do a bowel irrigation and remove all the stool, and we have to transplant the new microbiome there. It's not so. It may not replace all these therapies. These therapies will be still required after FMT as well. FMT will improve the neurochemical balance, so they respond better to all these therapies. FMT is generally safe when it is done in the proper way. There are two important things that we need to keep in mind. That one is the donor, the second is process. In the donor, if the donor has any ailments, that can be transmitted to the recipient. So the donor must be healthy, and they should be monitored on a daily basis. And the process of collection, process of preparation, transport, everything should be maintained. Like when the stool that is being collected from the donor must be done in a proper hygiene environment, not in the restrooms. And it has to be, there should be a maintenance of temperature, like cold chain maintenance should be there, and air exposure should be very less. And the process of preparation, like homogenization or centrifugation, all these processes should be in a clean and sterile environments. So then it becomes safe. Somebody has a deficiency of some vitamin or anything, they should be replaced. Like similarly, if a child has a bad gut microbiome, then only microbiome transplant should be considered. How to know whether the child has a bad gut microbiome or not? So so there are two methods. We can do a stool test. There are two different types of stool tests. One is 60-day RNA sequencing, other is shotgun metagenomics. They give the list of they will give a classification of bacteria that are present in the stool. With that, we can and the report that is generated from these reports will be 50% reliability is there, and this should be combined with another test like food allergy test or food intolerance test, which will show that they can act as a quality indicator. They will not give you the list of bacteria, but they will tell you whether the gut microbiome is good or bad. They will give quality indicator kind of thing. So if these two tests are done, that can then if you see lots of food intolerances and gut issues, then the child is suitable for the treatment. FMT is in the translational research, and it cannot be a clinical practice right now. But RISPLACE is trying to make it available for all the children with autism and other conditions in the supervision of Institutional Review Board or Ethics Committee, and we are putting a lot of effort to make it available for people. If the child is comfortable, stay away from all the treatment options. Like if the child is not comfortable and having lots of gut issues, immune-related issues, and the child is suffering, then you should look for the unapproved treatments. FMT is also FMT you can consider when the child has severe gut issues and unresolved with medications, and lots of immune-related issues and food allergies, food intolerances. And if you do a blood test for the food intolerance and you see lots of food intolerances on that, then you should consider fecal microbiota transplant. For this question, there are a lot of controversies there, because all the earlier studies, like 1 session or 2 sessions or 10 sessions, or once in a week kind of sessions were done. But in my personal experience and talking to people who has done FMTs earlier, at do-it-yourself FMT kind of thing at home, so I came to know that a regular FMT, for 2 to 3 months on a daily basis on consecutive days, has given a good result. In our personal experience and in our clinical practice also, we understood that if we do FMT on a daily basis for 2 to 3 months at least, will give a good result. So here I will divide the improvements into 2 to 3 categories. So first is improvement in the gut motility and digestion, absorption. So these are the things that will improve for these children. So they get the digestion process improves, and their overall gut issues will reduce. This is the first level. And the second thing is immune system. Their immune systems are much more regulated, and they will get relief from the allergies, intolerances, and other immune related issues. And if they have some autoimmune component also, they will improve. In autistic children, there are certain things like PANS and PANDAS. All these things will improve. And once their immune system is properly regulated, they will be immune for the opportunistic infections like Candida and other infections. And the third thing is the neurochemical balance. When the child gets a neurochemical balance, their sleep disturbances and overall mood disturbances and cognitive ability, learning capability, fine motor, sensory issues, all these things will improve. FMT is not FDA approved for autism, but it is approved for ulcerative colitis and Clostridium difficile, and it can be repurposed for many other conditions. Autism is one of the conditions for the repurpose of FMT, and it has to be done under ethics committee approvals and IRB guidance. RISPLUS is trying to do it in that way, and FMT is being explored for many other conditions like IBS, IBD, autoimmune conditions, and hormonal imbalances, and cancers, and many other conditions. So here in RISPLUS, we have a different concept of donor. In the entire world, the microbiome scientists and everybody believes in high diversity. And they prefer adult donors, and they want to have every donor should have high diversity to make sure that if the high diversity is there, is the high probability of having the all important microbes in that. But RISPLUS believes in essential microbiome that actually inherits from mother's womb, and every microbe that is colonized after birth, we consider it as a simple commensal, not an essential microbiome. So we take the children as donors. This will reduce the risk factor. Being adults, it's like duration of exposure to the chemicals increases, and also there are other problems like incubation periods for the sexually transmitted diseases is higher, and constant monitoring of their sexual habits and other things are not easy. So we prefer children as donors, and we take the children less than 12 years as donors, and we make sure that the process of collection to the administration, and we maintain the hygiene and sterile processes so that the stool sample is not contaminated. After FMT, we need to be still careful for a few months. The new microbiome that is being introduced will be fighting our own immune system, and it also will be fighting with the existing microbiome. So when this happens, there is something called die-off keeps happening. So when the die-off is happening, there will be cravings for sugar and everything. So the diet maintenance after FMT is crucial for some time, at least 3 to 6 months. So we should keep them away from sugars and junk food, and all these foods are like they fuel the bad bacteria. So diet is crucial for 6 months, 3 to 6 months after FMT. Procedure lasts for only just half an hour procedure kind of thing. It is once the child passes the stool in the morning, so we have to do a bowel irrigation kind of thing and remove the existing stool, and then do a retention anymore. All this takes around 30 to 35 minutes. The good thing is there is no pain in this. There is no need of sedation. There is no need of restraining. It is a simple procedure. But children will be resisting for few weeks, maybe a few days. After that, they understand it is painless and it is not harming them, and they start cooperating. The procedure. So we have a laboratory which has proper specimen processing unit where all the specimens are prepared in a sterile environment. We use a sterile environment for preparation, and for the administration also we use hygiene places like our procedure room is always, every time it is being fumigated and maintain sterility and all those things. We do not take any donor who has food intolerance. We consider that having food intolerance is a bad quality microbiome. So we take the children with zero food intolerance as donors, and their bowel habit should be in the morning, and it should be proper, and their stool quality should be proper in the morning, and their overall health should be good, and their mother and the parent should be healthy, apparently healthy, and we do a battery of tests to the child. We, according to the international stool banking consensus, and along with that we'll do a food intolerance test and few other tests, and make sure that the child is healthy and the donor is healthy on a daily basis. And every day we check for the stool routine examination for parasites and other things, and every now and then we do a cultures to make sure there is no infection during procedure times. FMT for autism in risk lies and other places is completely different. Why it is so? Because many of the FMT units, they prefer colonoscopy, and they do one session a week or one session a month kind of thing. Here in risk lies, we do not do such kind of thing. We will not use a colonoscopy, but we use a 60 to 100 centimeters tube that can that can cover the entire colon, and it can be done on a daily basis, and it is painless, and you don't need sedation for this, and you don't need a longer period of resting after the procedure. Once the child takes the enema and FMT retains enema, within half an hour the child will be playful, and they can go anywhere. So FMT is a daycare procedure, and you need not stay in the hospital. You just come to the hospital and they get the treatment, and you just go out of the hospital in just 1 hour. After that you can go for therapies and other things and other activities also you can plan. And for the staying, you can stay outside anywhere in the service apartments or other accommodation. Yeah, FMT is currently under research, so it is like the FMT that we are making available for people is like it is a do-it-yourself FMT under medical supervision. So it is only the expenses that will be taken, and the parents can come and do the treatment, do-it-yourself FMT under medical supervision. Yeah, FMT, apart from FMT, Resplice has a child development center which works like a school model, and it gives service from 10 to 4 or 10 to 5, which includes all the therapies like DT, OT, ST, special education. The child will not be missing any education or therapies when they come to Resplice. Generally, if we do 3 months of treatment for FMT, generally this microbiome will sustain. But if the child does not maintain the dietary patterns and other things, it can relapse. In those cases, the maintenance doses may be needed, like 10-day sessions or 15-day sessions, on a 6 months or 1 year basis. After that, microbiome settles and they may not need repeat session. The parents are allowed during the procedure, and it's a simple daycare procedure, and it's in a simple enema, and parents are allowed for the procedure. It is basically based on the holding capacity of the child. Even after they are doing a proper bowel irrigation or enema or anything, some children are able to hold up to 100 ml, 150 ml or 250 ml. Based on their holding capacity, it can be administered. But higher the dose and the success rate will be higher. So it is when the parents observe the child, their gut issues get reduced and their stool quality improves. And when the therapist sees them after FMT, then they start responding to the therapies better, and they start understanding the things more, and they learn better. So these are some of the things that you see, and their sleep improves, their overall mood improves. When you see objectively on the blood test, if you do a food intolerance test first, before FMT and every quarter after FMT, you will see a declining trend in the food intolerances level. This is one objective test that you can test the efficacy of the FMT. So we have seen, we have tried it for around 40 to 50 children till now, and it's been we understood a pattern here. Any child with zero food intolerance never improved. Children with food intolerances always improved. This was the litmus test kind of thing. If somebody has a food intolerance test positive or blood test, they will definitely respond. For speech, there are two things here. If some child has if the child does not have a Broca's area, Wernicke's area developed, it is less likely to develop speech after FMT for those children. For some children, those areas are developed in the embryonic stage, but they are not functional because of the neurochemical imbalance. Once a microbiome transplant is done, their neurochemical balance improves in those areas, and then they get some speech. And if somebody has some speech before FMT, their speech improves. FMT at Risk Place is completely dedicated for autism children, and the doctors and scientists who are working here, they understand pathology of autism better than anywhere else, and it's being proper. Everyone in the Risk Place has hands-on experience about how autism children respond to the gut microbiome transplant or FMT. In the Risk Place, the FMT treatment is being explored under supervision of the ethics committee and all the legal procedures, and the doctors and scientists take up the proper responsibility, and they have that accountability and maintain a proper methodology so that it is completely safe for children.